Good morning. I am Dr. Ashok Sharma. I am physician at Indraprasth Apollo Hospital, Delhi. Today I will be talking about what is high blood pressure or what is hypertension. Hypertension is known to everybody and everybody wants that he should remain healthy and his blood pressure should remain normal. So what is in normally healthy patient? Blood pressure rises in a day throughout the day and falls sometimes and remains. If it remains higher for a longer time then and remain untreated, it leads to various complications, that is effect on the heart, kidney and brain, sometimes even blindness. So it should be checked regularly and high blood should be treated when it is diagnosed. So high blood pressure usually develops over a time. It can happen because of unhealthy lifestyle, for example having lack of physical activity or obesity or smoking or consumption of too much alcohol. Other factor is hereditary factor. If your family members are having blood pressure, brother, sister, father, mother, then there are more chances that you develop blood pressure. Second, there are other risk factors also that increases the risk of developing hypertension. That is most common is age. Nobody can avoid this factor. As you become older, the arteries become stiffer and heart has to pump more forcefully blood in the blood vessels and face resistance, and with the age gradually increases, there is deposition of fat in the arteries also. So though thickness of arteries also increases, so blood get less space, so it increases. Other factor, obesity as also important factor. Then salt intake, excessive intake of salt is responsible for blood pressure. In Indian diet is contain 12 to 14 milligram of daily consumption of salt, or what is required is less than 5 milligram or 2.5 milligram of salt is sufficient for our daily. Excessive salt also, not eating enough foods and fresh vegetables, those that gives potassium. So if lack of potassium also increases the risk of stroke and kidney diseases. So eating processed food and fatty food increases fat throughout the body and makes harder work for the heart to pump the blood in the body and causing raise in the blood pressure. Other factor is lack of physical activity is also linked to obesity and further leads to high blood pressure. One of the most important factor for nowadays is one is the stress. Reacting to stress in unhealthy way or not managing stress can also increase the blood pressure. What stress actually causes is depression, lack of sleep and decreased physical activity. This all increases the blood pressure. So moving on, hypertension not only having symptoms, that is the more important thing, that is why call it as a silent killer, because it not having any much symptoms. It puts people at risk for several diseases. Long standing blood pressure directly affect on the heart and may develop heart attack and damages kidney failure or brain stroke, that is paralysis, and damage to the eye and may cause complete blindness. So hence early and accurate diagnosis is very important for management of blood pressure, and measuring the blood pressure is the only way to diagnose the blood pressure, whether you are suffering from blood pressure or not. It is very simple way. There is only one instrument made all over the world to detect the blood pressure, and that is known as sphygmomanometers. It should be measured. And what are the symptoms of high blood pressure? If suppose you are having morning high headache or morning headache, or you have tiredness or blurring of vision or buzzing in the ears, and you feeling fatigue, headache, nausea, vomiting and slurring of speech suddenly, if the person experiences some of these symptoms, he should be checked his blood pressure immediately. Fortunately, high blood pressure can be diagnosed easily and it is measured by sphygmomanometer. And the blood pressure is recorded in two ways, that is high and low. Highest blood pressure is known as systolic blood pressure and lowest is known as diastolic blood pressure. So for diagnosing one time blood pressure, one person should have two readings in two different places and both the readings are high, then again watch for a week with different timings, and if you continuously found that your blood pressure is above 140/90, then you can say you are having high blood pressure. Another now new thing that I developed to diagnosis is ABPM, that is ambulatory BP monitoring recording instrument, that is fixed at your home for 24 hours on your arm and it automatically records all the readings, and if you found 10-15 readings are higher, Then it also gives whether you are having white collar hypertension, that is when you develop blood pressure only when you are working in the office. Blood pressure is minimum when you sleep or take rest, and it shoots up early in the morning or when do basic physical activity. So ideal blood pressure should be less than 140/90, and if it is higher than that, then you require regular treatment. And what is the regular treatment for blood pressure? First thing is, we treat the blood pressure without any medicine. Try to change your lifestyle. It is a lifestyle disease. You are obese, you are smoking, you are having alcohol, you are having stress. These can be, and diet, taking excess alcohol or salt, these can be controlled by your lifestyle. Try that you should not take medicine on the very first day until it's very high, suppose 180, 110 or 120, moderate to severe hypertension, then require medicine immediately. If you found 150/100 or it is 140/90, then you try to manage for 2 months, 3 months without only lifestyle changes, without any medicine. And lifestyle changes, first thing is regular exercise, healthy diet, quit smoking, reduce alcohol, regular blood pressure monitoring, and stress management. And then if fails, then adhere to the medicine prescribed by a doctor. If blood pressure is successfully controlled by lifestyle modification, then it must be avoid or reduce the medication and further reduction in the medication. So you should go for regular or physical, do regular exercise or do physical activity. Exercise can be drug-free approach to lowering the blood pressure. Regular physical activity makes person heart stronger, and it increases the blood circulation in the body and in the muscles, and heart will require less efforts to pump the blood, and it lowers the blood pressure. In other case, we all aware that age and weight gain are the two major risk factors for developing of blood pressure. So as the age increases or your weight increases, your blood pressure should always be 120/80. People say, no, if my age is 60, 150/90 is alright. No. Now its criteria is ideal blood pressure should be 120/80, and if it is 130/80, you do not require treatment, but if it is 140/90 or 130/90, you require treatment. Other thing, what important, regular exercise also help to maintain the healthy weight. So weight reduction is also there with the regular exercise. And what is the best way to weight reduction is do at least 30 minutes of aerobic activities and 6 days a week, and do regular exercise, that is structured exercise, that is either brisk walking or jogging or swimming, but avoid weight lifting. And second factor is healthy diet. So diet plays important role. So if you have developed blood pressure, you start more eating fresh fruits and vegetables and whole grains, and this lowers the blood pressure. And other diet therapies are there, that is DASH, a Mediterranean diet, very famous, eating less saturated fat or total fat, and getting plenty of potassium and limiting the amount of sodium. So, and you have to reduce alcohol, you have to reduce smoking, you have to reduce tobacco and reduce sodium, and you have to increase the potassium and reduce the fat, no butter and high saturated food to be avoided, that is processed food to be avoided. So DASH stands for dietary approach for hypertension diet, eating DASH diet, which is rich in whole grains, fresh fruits and vegetables and low fat dairy products. This decreases cholesterol, lower blood pressure by 11 millimeter. If you are having a blood pressure, high blood pressure, even the diet change can reduce your blood pressure by 10 to 15 millimeter. If you diet control, reduce the salt. There are two types of patients, those one having salt sensitive hypertension, salt resistant hypertension. So salt sensitive hypertensive patient, if a small increase in the salt, their blood pressure increases. So reduction in the amount of salt is also very important. Reduction in the salt decreases 5 to 6 millimeter of blood pressure in a day. And for restriction of salt, whatever do, take the food and read their salt, food and beverages, and read their food levels, how much of salt they have contained, and processed food should be avoided, and avoid salt adding in the processed food, and use herbs and spices to flavor the food instead of salt. And people say that we can use other salt and this type of salt. No, always use Tata salt, or it is always iodized salt should be used. Stopping smoking, quitting smoking also reduces further improvement in the heart diseases. And regular blood pressure monitoring is a must for measuring of blood pressure. And some people prefer visiting a doctor, so regular blood pressure you should measure at your own at home, because and get it checked so frequently. So if you go to a doctor, he will be having chart and reading and data how much your blood pressure is there in a day or night. Single reading at the doctor clinic is not important. So long term period have a prediction, so it is settled, then it is easy for doctor also to manage your blood pressure. Stress management, nowadays do the stress management by the yoga, meditation, and do listen to the music or doing regular exercise. It's a good for the stress management. And adhere to your medicine, or 1 or 2 medicine what doctors has prescribed you. It is settled in 1 or 2 sittings with the doctors, and get once in a year your regular checkup, because high blood pressure also lead to other complications like diabetes or high uric acid associated with it, or thyroid associated with. So get once in a year all these related tests, and try to maintain your blood pressure less than 140/90, and adapt the lifestyle. And high blood pressure can be prevented and controlled by all these measures. Medicine carries less effective, and prevention of cardiovascular complications, other complications like kidney disease, brain stroke, and blindness or eye problem. Thank you very much.